Professor Meenakshi Sinha, Dr. Chetan R, Dr. Sikha Dondial, Dr. Mukul Mittal, Dr. Khyati Bakharia, Dr. Reena R. Kumar, Dr. Amandeep Kaur, Sanjay Kumar Patel, Dr. Jean Frederick. He's here. So you are going to present? Afternoon, no? Okay.
So now Ramajan's research topic, right?
Yes, but I don't know where it.
Meenakshi will call.
But Ramanjan Sinha. So giving talk online. Giving. She is going to talk. So that we can have a whom to like contact. Okay. 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 So Dr. Chetan R. No. You know. Yes. Dr. Ramanjan Sinha. है मेरे पास तो है। तो वहाँ पे अनाउंस कर रहे हैं कि मतलब बड़ा वहीं बैठे हैं पहले वाले हॉल में वहाँ है ना कि दो का 40 91 590 तो आए फिर से
Hello. 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 आवाज आवाज नहीं है। अच्छा, एक बार वो भेजिएगा। हाँ आओ सर।
लिंक शेयर करो।
मुझको ऐसे पहले
मुझे शेयर करो।
लिख पहले
वो स्पीकर को भेजना है ना।
हेलो
हाँ
हेलो
आवाज आ रही है आपको?
हाँ
दे
हाँ
दिया।
आ रही है आ रही है।
और यहाँ पे करना है, हमको लिंक भेजनी है।
यहाँ दे दीजिए सर, ये ज्वाइन हो जाएंगे, जो भेजेंगे।
ठीक है, ये आज पे यहाँ पे कॉन्फ्रेंस होगा।
ओके सर।
हो गया। मुझे कोई जाना नहीं है।
हम ही हैं।
वहाँ तो जगह हाँ यार, ना करके कोई बैठ नहीं। आप इधर कहाँ चले गए?
इसको पासवर्ड बताती है सवाल ये थी आपको अच्छा भेजिए।
हेलो हेलो
क्लियर
सर को तुरंत भेजो और उनके
हेलो हेलो
ठीक है स्टार्ट करो।
वो सब भेज दिया मैंने।
मैंने भेज दिया।
हेलो
हेलो
हाँ राम बात क्लियर है।
हाँ वॉइस आ रही है।
ठीक है एकदम क्लियर है।
ठीक ठीक
दोबारा डिस्कस कर। ये क्या करना है आपको, जैसे कोई ज्वाइन करता है ना, तो यहाँ पे क्लिक करके मेकअप पैनलिस्ट अटेंडेंस बनाना पड़ता है, तब उसके बाद वो उसमें आएंगे पैनलिस्ट में, तब वो म्यूट कर पाएंगे, नहीं तो अपने आप को म्यूट भी नहीं कर सकते जब तक हम। राहुल आप म्यूट कर लीजिए अपने आप को। हेलो अच्छा चलिए चल फिर आगे करते हैं। फिर ये तो हमें अपना अच्छा हेलो
हेलो हेलो
आपकी वॉइस आ
आवाज
रही
आ
है?
रही है।
हाँ हाँ
हाँ
वॉइस
हाँ
आ रही
एकदम
है।
क्लियर। हाँ हाँ क्लियर।
ठीक है
हमारी सही है ना।
हाँ
हाँ
हाँ वॉइस है।
ठीक ठीक ठीक। हाँ जी सर, मैंने लिंक शेयर किया था, पासवर्ड भी शेयर किया था, ज्वाइन कर लीजिएगा। जी सर।
राहुल तेरा नहीं मतलब मैंने आप राहुल 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 अपन बोले हैं। हाँ वाइस आ रहा है, हम बोल हेलो।
हेलो। बहुत वही आता है, कोई कोई बोलता नहीं है।
वाइस आ रहा है। हेलो। हम्म। हेलो।
हाँ आवाज नहीं।
हेलो।
हाँ आवाज।
तुम्हारा नहीं है ऐसे। हाँ वाइस है। हाँ सर। हाँ हाँ सर वही है। हाँ सर।
भारी में कपड़े थे, कल जैसे नहीं है।
कल सर। हाँ वो पता नहीं कौन खड़ा है, पूछ लेते हैं। हेलो।
हेलो
लीजिए।
हेलो।
लगाओ। हाँ राहुल।
हाँ क्लियर है। हाँ हाँ बोलिए।
So back in 2009, we had 138 active. That was a timeline from 1985 to 2009.
Hello. Hello.
Hello?
Hello. Can you hear me?
Yes, sir, we can hear. Can you hear me, sir?
Yeah, I can clearly hear you.
Oh, okay, sir. Okay, sir.
Sir,
Good afternoon. Starter, Professor and is Rathod, Department of Physiology. Now we are going to start this session.
अच्छा पूछो बच्चे लीव कर रहा है हेलो 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 सारे मीटिंग में से लीव कर लो अपने आप सर अपने आप अपने तरफ से अपना वाला
Yes, sir. Is there issue, sir? Yes, sir. Yes, sir. Yes, sir. Please. Okay, sir. Okay, sir. Okay, sir.
Okay, can you see my slides?
Yes, sir. We can see you, sir.
And you can hear clearly, right?
Yes, sir. We can hear you.
Okay, so I'm just starting. Thank you, first of all, for the organizers to give me this opportunity in presenting the topic, exploring the duality of physical activity and mental health. I worked on this little bit some time back, and also I'm interested in looking into the mental health aspects of exercise mainly and some of these things. So I'll touch a few pertinent points on this, and I'm sure that the audience over there is very specific and learned, and I'm sure all of you will appreciate some of the facts which we are going to discuss over here. The first thing which we need to see is there are several very eminent personalities who are talking on this particular aspect, in the sense that physical fitness is definitely part of a healthy mind. And definitely it will it will be good for the mental health. And of course, as you see, the father of aerobics, Kenneth Cooper, says the exercise is for the quality of the life we enjoy. So that is a very important part of this mental part of exercise, in the sense that the more we perhaps do a good exercise, the more mentally rich we will be. Is it so? Is it not? So these are the few things which we are going to look into a little bit. As we know, a lot of discussions have been going on regarding the brain benefits of exercise. It definitely would help to produce some neurochemicals. It improves memory, lengthens attention span, boosts decision-making skills, growth of nerve cells, multitasking. So many different aspects of exercise have already been researched thoroughly and looked into all these facts. Physical fitness as a contributor of mental health really came through some of these important studies. I would say I would mainly impress on an Indian study done on 2023. People achieve better psychological studies. They compiled the review of molecular level studies, organic level studies, and systemic level studies, and had written a thorough review on how the psychology is affected at different levels. And also, of course, susceptibility to depression, as well as it is documented to have a significant effect on even plasticity of the brain, or how brain changes over time. Dwelling on a small little bit on these things, it has been seen that across the world and across our country, of course, these are the main thrust research goals over which we see the research is going along regarding, let's say, alleviation of stress and exercise, alleviation of depression, alleviation of increase of mood and cognition and all these things. So many different work has going on, and it's a huge compass of work which goes on. So a little bit of things which I think some most important points that have come up is the first punchline. It has been seen that the sub-maximal exercise is most beneficial. We have to be careful in looking into the facts that when we see these studies and when we look into each of these studies, it has been seen that people going through a optimal exercise, self-paced exercise, and not imposed exercise regimes. We are always talking in our conference about or in our discussions about what exercise we are going to do, what target we are going to keep. But a optimal exercise is always means some exercise which we are enjoying doing, which does not stress us out, which does not stress us regarding a target, but at the same time we enjoy doing the exercise. And it has been, all these studies and several more studies have shown that self-imposed, selected condition and suboptimal exercises are really has been beneficial, particularly with relation to brain remodeling, vascular formation, at the same time particularly improvement in brain health. So this is something which I'm stressing, or I'm going to say, or I'm going to talk, or we are going to emphasize on this particular aspect. So we did some studies as early as 2014, very basic studies. I would say we had some postgraduates and we were doing studies. In between, I left these studies. But then in anxiety and EEG correlates, what we could do was we correlated the anxiety scores with that of exercise. And if you see, we did a state trait anxiety inventory study, the Spielberg's. You would see the reduction in the state, reduction in the trait anxiety, and total anxiety is reduced pre and post exercise. Now these values, if you see that in male always and also in female, you would see both the state and trait anxiety is depressed or decreased over time in these people. A group of around, I think as far as around 45 subjects we did on this study, and we found this. Now this was a questionnaire. Sometimes questionnaires doesn't speak truth. There is a lot of subjective effect to it. So what we could do was we studied anterior brain asymmetry in EEG as a biological marker for exercise affect relationship. In this particular type of study, what we looked into is, when we talk of anterior brain asymmetry, we talk of right versus left or left versus right difference in the EEG waves. And this hypothesis, which we call as a cerebral lateralization hypothesis, is a quite a good and a robust indicator of anxiety and depression if you use EEG. In the sense that we had worked on a lot of patients on generalized anxiety disorder, panic anxiety disorders, asked them to do an exercise, did their EEG findings, did their EEG recordings, tried to find asymmetry. But then some very basic studies which we did was the frontal asymmetry, particularly post-exercise, was very high. In case of female subjects, even pre-exercise asymmetry was not that bad. However, on the frontal asymmetry, you could see there is an increase in frontal asymmetry, particularly in male subjects, left versus right. There is a big asymmetry in between these two. At least it was found to be significant at that top of time. We could not go ahead and do the topo plots because we didn't have the software to do the topo plots. But then we could put it as a biological marker in the sense the presence of alpha, it shows generally increase during aerobic exercise with increased brain activation in other areas. This is equivalent to Solomon's opponent process theory. I'm not going to explain Solomon opponent process theory over here. You can look after this. And it is said if there is a paradoxical change in the brain activity depending on the type of work you are doing, particularly when the work involves reward and punishment. Here I take the punishment as you are giving the patient who is already depressed a target to achieve for an exercise versus a patient you are giving non-targeting for exercise. They can do at their own pleasure, keeping at a maximal level. Left versus right activation, which I was telling, approach and withdrawal in resting and post-exercise. This is what we call as cerebral lateralization hypothesis, which says that left and right activation difference between them if it is high. In other sense, the right activation and the left activation differences, the more the difference it is, there is a more, let's say, the effect of post-exercise effect of effect on anxiety and depression is there. So it is one part of it is there. The third part what is each activity mediates exercise affect relationship. Exercise affect means the emotional part of the relationship with exercise only with submaximal exercise intensity and duration of 20 to 40 minutes. So you decide on a submaximal intensity. How we decided? We decided up to a heart rate of 120 to 140 beats per minute. Let's say when he achieves that level or when the patient is comfortable at a particular level of exercise and they choose a time period of 20 to 40 minutes at their own time of the day when they could do the exercise. So it was totally a pleasurable experience for them, and as long as it was optimal and they found the, let's say, the notional release of endorphins and such things, and they were happy doing this particular type of exercise. This is something which we looked in. So now we all know about this. So the spectrum of benefits with exercise to the brain is one side, it shapes the brain with experience of exercise. So there are changes or plasticity occurring in the brain, and also around the brain you would find that enhances the brain as a whole, which benefits cerebral environment through very various or many different factors. So all these factors must be discussing in detail by our so many learned across the world presenters in this very august conference. I'm so very glad and enriched to discuss. So exercise mainly, if you can see, two inhibition points, macro level risk factors, cortisol and long-term stress. Cortisol and long-term stress, therefore they mainly risk and rate and progression of Alzheimer's disease with age is prevented by sort of prevention of risk factors, long-term stress, and also improved cerebrospinal level flow, and also which inhibits formation of beta amyloid PET. So there are a lot of ways by which there is a brain changes, plasticity of the brain and environmental product, which sort of reduces the risk and rate of Alzheimer's disease. The brain-body connection in exercise, we know it has a sort of what we call as push-pull relationship. Through all these spectrums, if you see here, and all these spectrums over here, if you match antioxidants with free radicals, if you add neurogenesis with decreased neurogenesis with chronic stress, decreased depression with exercise, whereas stress causes increased depression in exercise. So all these have a push-pull relationship and balance between these two. When we talk of balance between these two, the fact which comes to our mind is, first of all, three very important monoamines, the dopamine, the noradrenaline, and the serotonin. These are some important monoamines which contribute in different ways. I have written over here, probably you can see, I'm not reading them out, but these are certain monoamines. They are either acting consolidating memory and consolidation through hippocampus. Some are helping in neuroplasticity and post-exercise recovery, whereas serotonin receptors are antidepressant and anxiolytic properties, as well as cognitive function. This place has been stressed again and again about these neurotransmitters. If we see ahead, the two main mediators which has come out through all these studies are mainly BDNF and adiponectin. The hippocampal brain-derived neurotropic factor levels determine neurogenesis, long-term potentiation, and synaptic plasticity. It has been found the central is BDNF, which is stimulated by exercise, and this BDNF through different positive effects, if you can see, that it causes increase in memory and hippocampal function, and definitely through other activation, exercise causes activation of IGF-1, vascular health, decrease in cortisol levels, and so through all these levels exercise potentiates BDNF function, and several studies have been around BDNF itself as a very important neurogenic and neuroprotective function. On the other hand, if we see, the role of adiponectin has come out as a very important factor over several studies. I have just quoted one representative study, that's all. But here if we see that all these factors acting through these particular effects, for example, the FNDC5 is a myoadipokine and it modulates metabolic and protects against obesity. So FNDC5 is a very central sort of what? I think the presentation got down and here only. Sorry. Okay. Is it okay? Can you see? Yeah. So here FNDC5 is again a central figure which has come out in case of BDNF expression. As I said, it is a myo and adipokine and modulates metabolic and protection against obesity. PGC1 alpha, if you see a lot of literature going on in ERR alpha and PGC1 alphas. PGC1 alpha helps in mitochondrial biogenesis and remodeling and oxidative and glycolytic some substances. So mitochondrial biogenesis, again adiponectin which is here, it is a very important hippocampal neurogenetic substance. It increases glycolytic and fatty acid oxidation in liver, and therefore it increases hunger and sort of acts on adiponectin acts in sort of antagonistic with leptin, which decreases hunger. So they are mainly adipokines which act, and they have a lot of function on expression of cognitive learning and memory. And exercise induces all these factors, it has been found, to increase cognition, learning, and memory. If you see, how about long-term physically fit people? Here we did a work that students who are physically fit are not necessarily the brightest who can handle anxiety very well. We have seen students playing in fields, and are they coming first? So is it that a healthy mind actually resides in a healthy body? Is it true? Is it a fact? So when we look at neurophysiological profiles of individuals with higher physical fitness, they might reflect better handling of anxiety. But surprisingly, we see the trait and state anxiety in low fit versus high fit people. If you see, there is hardly any difference. We could not find much difference in state and trait anxiety in high fit and low fit people. So anxiety alone may not be a determinant of mental health in high fit and low fit subjects. You would see that best students who are studying very well, they don't work, they don't study, they don't do anything, as we call them nerds. They handle anxiety quite well and do well in their exams. People who are sports persons doing very well, they're not necessarily very bright in exams. But at the same time, then where our brain plasticity, where our cognitive function goes. So if we just try to measure their anxiety and depression alone as a representation of cognitive function, that is not true. Anxiety alone cannot be a only determinant of such activity. There are very different, let's say thousands of other determinants of cognitive function which they fare better. In the sense, if you see that alpha for asymmetry in high and low fitness group has been quite high. So if you see particularly in frontal alpha versus the low fitness index, it has been seen that the high fitness group has a better alpha as compared to the low fitness groups. In the temporal, occipital as well as frontal regions. So they have a predominance of alpha, showing that high fitness people can keep calm in front of stressful environment. Now that stress has to be defined. Is it a physical stress? What type of stress? Are they prepared for the stress? Is it a mental stress, or what kind of stress? So further studies would definitely find out some of these factors which we are discussing. So in these subjects, alpha predominance in the temporal right hemisphere, if you, for example, if you say it implies better attention, perceptual learning, identification of form and shape, all these visuospatial coordinates which are important for athletes. So all these substances or all these factors of cognition does increase in case of physically high physical fitness fit, and anxiety is only not the parameter. So future studies can be carried out with all these cognitive parameters. Why highly fit individuals are called cognitively better as compared to students who are nerds and coming first in class. The third point, the last point which I would like to make is high intensity and target oriented exercise has been detrimental. We have seen that in abroad, especially in China, Japan, all these highly super competitive places, they place excessive stress on physical activity and all these, and so they develop a high incidence of severe psychological disorders. In fact, we have seen that in Gulf War illnesses, you remember the Gulf War, which took at a very severe in our early 90s, we took this Gulf War, and all these soldiers who faced not only physical exercises, but they faced severe memory loss, or sort of nervousness and anxiety and mental disorders when they go through extreme physical conditions. So extreme physical conditions may not be true. What about stressful challenge? Stress before exercise. The experience of stress impairs efforts to be physically active. Habitually active individuals exercise more in the face of stress, and those in the beginning stages exercise less. So stress before exercise is actually detrimental. So far we were talking about how the exercise affects stress. This is one line which I would like to highlight in this presentation. So as we see it now, effect of exercise is not beneficial across all ages, selective to the type of disorder these people are having. I'm not talking of otherwise healthy individuals. Intensity and context of the exercise is important for mental health, especially relief from anxiety. Physically fit involved individuals may not have the edge over others across entire spectrum of mental faculties. There will be specific spectra which we need to address, and BDNF and adiponectin are among the emerging mechanismal approaches to psychotherapeutic effects of exercise. I think this is about what I wanted to say and what we wanted to discuss. So summing up, exercise and relief of stress is definitely sort of imprisoned or sort of conditioned to certain conditions of exercise. It will handle certain types of stress, and it is definitely not applicable or may not be applicable to all types or all angles of cognitive responses in people. I think this is something which I wanted to present. Thank you all. Thank you very much.
Thank you very much, sir, for the talk on the duality of physical exercise and mental health. And we are
Thank you,
overwhelmed
Gagan.
with your talk, sir. And if somebody has any question, please ask. Do we have a question for sir? The topic was well understood, sir.
Thank you.
Thank
Thank you very
again
much.
for
Uh,
session one here, sir. And,
Thank you. I'm very glad that I could participate. And I thank again Dr. Gagan for organizing this wonderful conference. I can see these people coming up, very young people coming up very rapidly, young and fit people, bright and good cognition, good physical health, a rare combination. And one, I mean, you will keep going ahead, and we expect a lot from the whole young bunch over here who are working. Thank you very much. Thanks a lot, really.
sir, question.
Hello.
Question is there for me, sir.
Hello. I have got a question. Hello.
Sure, please.
I am Sen Gupta, Arnav Sen Gupta.
Okay,
Hello.
yes, sir.
Yeah.
Sir, thank you. You are around, and it is a pleasure to have you around.
I just one question that as well measuring the alpha frequencies, what actually you are doing? Are you measuring the power spectral density by taking the EEG data and using software and thereby comparing this to across the industry? That's this is my point.
Yeah, actually, this was one of our earlier studies. And now in our advanced machine, we are doing like topo plots measuring power spectral. That time we only calculated the absolute and relative power. And on that, whatever found we give, the bar diagrams are totally inadequate for EEG findings, but those were some preliminary studies and findings. So I gave, they were mainly about absolute and relative power. And from power spectral density calculation, we converted and we measured the absolute and relative power. Thank you, sir.
Thank you very much, sir, for the talk. Now we will conclude the session, sir.
Thank you.
Now we proceed forward with the next session, which is of Dr. Meenakshi Sinha, ma'am. She is a professor in AIIMS Raipur, and she is a renowned person in the field of chronomedicine and chronobiology. So now I allow ma'am to join. I think she will join and present a talk now. No issue, ma'am. Same, no issue. Okay. 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 No? I don't. सारा No. वो वही कर रही है वो था वही कर रही है Good afternoon, ma'am.
Yeah. Am I audible?
Yes, ma'am, you are audible, ma'am.
Yeah. Should I start?
Now, Dr. Meenakshi Sinha, ma'am, Professor, Physiology, Department of Physiology, AIIMS Raipur, going to start. She is a known person in the field of chronobiology and chronomedicine. Over to you now.
Okay, thank you. First of all, good morning to all of you. And I would like to thank the organizer first for inviting me to be a part of such a wonderful conference. And it's a pity that I cannot be there physically. Would have loved to be there with there and physically presenting. Not possible due to some unavoidable circumstances. So let's start with the presentation. First of all, I hope my slide is visible. Is it visible? No, just a second. I'll start sharing. Is it visible, my slide? Um, yeah. Just give me a moment. I'm just setting my presentation slides. So, yeah, just a minute. Yeah. Is this visible now? Hello? Okay, okay, right. Thank you. Well, the topic you would find is slightly different than what you have been discussing. Maybe it's a different approach to what you are right now talking about. My title is Timing of Exercise for Optimal Health Benefits. Basically, in the recent year, some groundbreaking research has revealed very clearly that exercise is not a one size fits all solution. What has come up now very recently, some recent literature and lots of studies, that physical activity can have a significant impact on the effectiveness and on various health consequence outcomes if it is timed to your performance, peak performance level. Now, what I mean by, and not only with the peak performance, your metabolic health, your cognitive health, all these are affected with the timing of the exercise when you are doing. So here comes the concept of chronomedicine, which is dealing with the time, because as we know, we go further from here, we know this, the circadian rhythm, which is basically the 24-hour rhythm. And it's not only the 24-hour rhythm, our body is rhythmic like our nature. So we find that cyclicity exists in almost all the variables. And same here, as you can see, the circadian rhythm cycle for your activity, for your performance. Why? Because we find that there's a time when you perform best and there's a time when we perform less. There's a nadir and there's a peak. This goes for all the functions of the body, starting from the cellular level to the tissue level to the functional and to the organ level, wherever you look into. So where we find that the best coordination may be in the afternoon part, fastest reaction in the afternoon part, whereas in the evening time when you have higher blood pressure, because this is normal rhythm. Circadian rhythm, I hope what everybody knows is what I mean by this is the 24-hour cyclicity or a cyclic pattern of all the variables which is repeated every 24 hours approximately, and which is tuned with our sleep wake cyclicity. So the light dark cycle is a very good important cue for maintaining this rhythm in the body, which has a genetic basis, right? And just to give you a very brief idea about the background of the chronobiology. So we find that you have the highest body temperature in the towards evening time, highest blood pressure towards night. By 8, 9 o'clock, your melatonin secretion for pineal gland increases highest. It reaches at about midnight, around 1:30 to 2 o'clock. Your lowest body temperature maybe is early in the morning, and that is the time you will find the melatonin secretion stops or comes down to a normal level, very low level, and you have the cortisol secretion increasing, and that is the time when you find that the alertness of a person is increasing. Now, this is just a pattern which we see normally. How do we get this? How does the body get it? The basic principle of this is that the light and dark is sensed by the suprachiasmatic nucleus situated in the hypothalamus, known as the master clock, through eye, which is retinohypothalamic tract, and from there the information is reaching via the superior cervical ganglion, the thoracolumbar segment, same the sympathetic fibers, reaches to the pineal gland to control the secretion of melatonin hormone, which is known as a chronobiotic, giving time to the body. right? And therefore, the body knows that this is the light and this is the dark phase. Accordingly, the information is coming through the retina. And this light and dark phase is actually coordinating the body functions to a rhythmic pattern for almost all the functions of the body. Now, this is a photic Z giver. Z giver is the time giver, the cue, time cue. Whereas there are non-photic Z giver also. The non-photic are very important. Non-photic is you change your sleep wake cyclicity. You change the timing of your physical activity, exercise. You change your social time, your timing of, activities or doing some kind of reading or other activities, or your meal timing. Even the nutrition, the type of nutrition, all these have important role to play in the synchronization of the circadian rhythm. But however, the light dark cycle remain the most important component of this. Now, to give another example to you all, as you can see, this red color one is the melatonin hormone and the black one is the cortisol, right? You see, it's almost like an opposite rhythm they have, both of them. It's a 24-hour cycle, right? Start from full day. And what we find when the melatonin is highest, that time the cortisol is lowest, and melatonin early in the morning when it is lowest, that time is the cortisol when starts increasing. Cortisol, as we know, for any kind of fight and flight reaction, any kind of physiological functioning, these hormones are very important. Just to give you one example, right? Besides, as you can see that, as you can see, the blood pressure, heart rate, and the cortisol hormone. See the link between them. The blood pressure and the heart rate is normally the peak, the maximum. Blood pressure and heart rate comes after afternoon, late afternoon to evening, whereas cortisol rises early in the morning and remains high till the midday. Okay, so this is the way the rhythm is going on. So, if you see these factors together, there is a relationship which we can find between the temporal variability of these factors on the peak performance or exercise performance or activity of the person. So time of the day when the activity is being done, amount of light you are exposed to. If you are in a darker room and maintaining a cycle, you will find that whole of the rhythm pattern which I just showed shows a difference. They are altered. They do not have the similar type of response which is seen normally with a 12-hour light dark cyclicity. Sleep and meal timing, as I have told, and another very important factor is chronotype. Now, what is chronotype? I'll just come to that. That is our own peak preference time. I'll come to chronotype. I'll talk about it later, slightly later. So circadian timing in physiological, psychological, and molecular mechanisms are important for optimizing sports performance, right? How does it do it? What do we see? What are the literature available for this? Time of the day. What has been found is, you see, this is the body temperature rhythm, right? Evening, night time, you have the lowest body temperature. Daytime, you have the highest body temperature. You find when the body temperature is highest, the general athletic performance, muscle contraction, these activities show a peak. Whereas early in the morning, when the body temperature just started rising, you find the sprints types of activity or rapidly performing activity show the peak type of performance, best performance at that time. So, the athletic performance requiring physical effort and strength are very good during late afternoon with peak in the body temperature, when the body temperature is peaking up, maximum. So diurnal changes are closure which are related with the change in the body temperature. That's what we are seeing. Secondly, what we do is find skill-based or fine motor controls are much better performed in the morning up to the noon time. Okay, so that means even the type of exercise or activity has some relation, temporal relation with your body temperature and all some other variables also. What happens when you're doing a morning hour exercise? Now, morning hour exercise is known to cause greater weight reduction, better energy and mood boosting, morning type exercise. Sleep is much better in those people who do the morning exercise. More fat burning is possible, control blood sugar level, effective appetite control and calorie intake. Now, this is the effect of morning hour exercise. Does it change if I do evening hour exercise? Yes, it does. There's good literature, good amount of literature to show that if a person is indulging not in the morning but in the evening time exercise, they have better muscle gain, first of all. They fall asleep faster. Now, in the morning, I showed they have a better sleep, and this is better, faster sleep. So, latency to the sleep is decreasing because they are doing exercise in the evening hours. Less oxygen consumption, increased exercise capacity. So, basically, normally what we find is athletics experience peak performance in the afternoon, both for the aerobic exercise as well as for the strength training. Okay, so best time is afternoon to evening, that is 2 p.m. to 6 p.m. when the body temperature is at its highest level, which help in optimizing the muscle function, endurance and strength. Okay. Now, if the subject person is doing exercise before bedtime, would it affect? Yes. If you do just before the bedtime, first thing which is seen is the person cannot fall asleep faster. The person would remain awake for a longer time in bed because of higher sympathetic level. Sweating. But however, it is found that because when you are doing the exercise with sweating, it will cause increase in the body temperature because you're sweating, your body temperature is increasing, metabolic rate is increasing, that can boost the heart rate and therefore a good night's sleep is possible. Does it mean that we should do the exercise before bedtime? No. What I mean by this is better quality of sleep would be achieved only and only if it is done at least 1.5 hours before the bedtime. If you do just before the bedtime, your sleep is going to be affected, your performance would be affected, and the beneficial effect of exercise would not be seen that much. Okay, right. So, exercise has its impact. Now, till now, what we were talking about, circadian rhythm has an effect on the exercise performance. Now, can exercise change your circadian rhythm? Yes, it does. What we find is if you are doing the exercise in the morning hours, this is morning hour exercise. This is your normal rhythm, this gray color, and the red one is the shift. So if you're doing the exercise in the morning hour, what do we find? The whole rhythm, whichever rhythm you are talking about, internal circadian rhythm, will shift to earlier time. Okay, so that means there will be a phase advancement. A phase advancement of the rhythm will be seen if the exercise is done in the morning hour and vice versa if it is done in the evening hours. In the evening hour, there will be a phase delay. That means timing of exercise is impacting your circadian rhythm. And the circadian rhythm, why do we require a circadian rhythm? For the reason, because we have to tune with the light dark cycle. We have to synchronize the body function, and the body, when they are synchronized to each other, the functions, then only the optimal health is possible. And that's why we are trying to have a synchronized status of body, right? Do we have report for this? Wonderful reports are there. You see, there were some good literature which are available where what we found is that they collected the swimming data, the swimming events which are taking place during the Olympic Games of Athens, Beijing, 2008, London 2012, Rio de Janeiro 2016. These data were collected, and what did we find? That they actually saw the effect of time of the event and its circadian effect on its performance, right? What did they find? What did they find is the performance was strongly affected by the time of the day. Time of the day. And the event was held in the late afternoon. The late afternoon, this time, right? This is 16 to after 16 hours, evening hours, afternoon hours, late afternoon to evening hours. The performance was best for the subjects. Whereas if the event was held in the morning hours, the performance was low. Worst performance was seen. What do we see? Even for the athletes, the timing of the day matters, right? This is in general. We have not talked about the chronotype yet. But same thing, in some other work, literature which has shown is there is a diurnal variation. Diurnal is day-night variation in the alertness of the subject and the fatigability, the self-rating fatigability of the subject. What we find is that the alertness goes on increasing from morning to the evening hours, and after that it will reduce, whereas the fatigue goes on decreasing in the evening hours, right? Similarly, the performance on the juggling type of events or the wall volley test according to a time of day, you see the maximum was reached in the evening or the late afternoon time. So optimum soccer specific skills was seen, the maximum performance was seen at between 16 to 20 years, and which was found to be very much related to your body temperature rhythm, provided your body temperature peak is coming in the evening. Okay, right. So, morning and evening timing. If now, this is till now we talked about the events, exercise you're doing. Suppose you're doing training for doing some performance, some event, you're doing some training. Timing of training also has its impact on the physical performance. What do we find? That the morning training, the performance would be the amplitude or the increase and the change in the performance would be there in the afternoon, whereas in the evening, if the training is done, the amplitude is much higher. That is, performance is increasing much more. So morning training increase performance in the morning hours, whereas evening training increase the performance in the evening hours, right? Just a second. Hello? Oh, just, okay. I'll just finish in 2 minutes. So I'll finish with this thing, is that the type of chronotype which I was talking about. You know the chronotype is the preference, natural preference of the persons to for a certain activity of the time, peak performance time. And we have 3 types of typology or circadian typology or chronotype. That is morning type, intermediate time, and evening time. And what we have found that the circadian phenotype, this morning, intermediate, and evening, they have different timing of their peak performance. Morning performing best in the morning hours, evening performing best in the evening hours, and intermediates have in between 5. So this is the way we actually have it. So later chronotypes, that is the evening chronotypes, they're associated with more diurnal variation in the performance, causing an additional selection pressure towards the earlier chronotype. Basically, whenever the selection is being done, the earlier chronotype, those people who prefer working in the morning hours, their preference is for the morning hours, particularly in the Olympic athletes, they are preferred than the evening type people for the reason because then they can perform better in the daytime. Most of the events are held in the daytime, right? So prevalence of morning type among sports person is highest. Right? So exercise in the natural light is the best remedy for making your body work in a normal synchronized manner. So working in the light, natural light, sunlight makes the body to be in sync with the light dark cycle, and therefore brings the maximum performance achievability. And that's it. I will end up with this. The chrono exercise concept. So another concept is that there is an interaction between the circadian clock and exercise, which is actually the chrono exercise. So timing of exercise affects the phase of circadian clock. Circadian clock affects the exercise related athletic performance and energy metabolism. So light, sleep, meal timing are moderators in circadian impact of exercise. Training time could be scheduled according to the chronotypes. performance depends on the time of the day and chronotype. With this, I come to the end of the my talk, and I hope you have I could convey to you what I wanted to convey. Thank you very much for allowing me this time. Thanks for your patient hearing.
It was an insightful session on chronobiology, academic on experts performance. We can take a quick question if somebody has a question. One question, please. Only one. Nobody has a doubt? Okay, please ask. Ma'am, one question for you.
Yeah, sure.
Hello? Ma'am, how does time zones affect the circadian rhythm? Somebody, any national athlete, travel different time zones for competing. So does that affect any way in their performance? Does that affect their body clock or based on the sunlight, their rhythm matches?
Can the question be repeated? I could not hear the question because the sound is not coming clearly. Maybe Dr. Gagan can repeat the question.
Yes, sir. Question when changing how does it affect the test of performance? Changing energy.
No, the sound is not clear. Can you please repeat? Sorry.
And so changing
The audio from your side is not coming properly. Can you repeat the question?
Can you hear me, ma'am?
Yeah, I can hear you.
Ma'am, I know that's change in time zone affect the sports performance at academic time zone.
Oh, different time zones. Yeah.
Yes, ma'am.
Yeah, if the person is in a different time zone. It's a very important question. I did not touch upon it because of the lack of timing, but it's a very interesting question for the reason because athletes, especially, they have to perform at a very different time zone when they start from this place and suppose they go to Paris or somewhere else for performing for any of type of event, they're going to a different time zone. Jet lag, right? Mainly the jet lag. So there are so many remedies which have been given for this. If they are going to a different time zone, there are two, three things. One is very interesting concept has come very recently, which is known as sleep banking. The word is sleep banking. They should sleep for reserve of the sleep because they're going to be up in the odd timing hours, right? That's one thing. Secondly, try to maintain the normal light dark cycle by the, first of all, timing of the food. Meal timing can be adjusted. Secondly, light exposure can be adjusted. Be exposed to a higher degree of light, the intensity of light, which can be done nowadays with lot of type of light available, which can give you that kind of light exposure which a sunlight will give, so that your body is synchronized and your performance still remains better. And a third, which is very commonly used these days, is the use of melatonin. At the times, the subjective night, because you are in the subject, different time zone. So the day is, that time is day, but for you it is subjective night. So to synchronize this, the role of melatonin has come into picture, very much in use. And melatonin, which is kind of a chronobiotic with no known side effect as such, right? And what happens is giving the melatonin at the time of your sleep hour would give you a stimulus, would give you a cue that this is the night for you. So you go for the sleep and then you can readjust your cyclicity. So working in a different time zone requires training and discipline on the part of the subject or the athlete who is going there. It's very important, and that goes for everyone, even for us. If we are going abroad and different time zone, these things will be required. Very much helpful. Is that okay? Anything else?
Okay. Now we conclude the session.
Thank you.
We'll complete the session. Thank you, ma'am.
Thank you.
Yes, ma'am. Now I invite Dr. So this is a very interesting symposium which will tell you about dynamic landscape of sports medicine and the evolving roles in different scenarios. So it is a symposium that has four speakers working in different scenarios. Right? So introducing my first of the speakers is Dr. Uttar, who is currently working as an associate consultant with BNK Max Hospital, Advanced Arthroscopy Center and Rehabilitation Center for Sports Medicine. And second number, I will be calling a special person who may be known in an introduction, Dr. Shikla Ramya, team doctor for Varanasi, and also team doctor for ISSEM Women's Division. Shikla Ma'am will say a very special person and a very special to guys. Then start listening to response. Okay, very few people, so it's for everyone. So Dr. Chetan, medical officer and administrator there. I will share your response, medical office. There is very rare combination that an athlete and doctor can go in simultaneous international levels. Have you heard any combination like this? So I recommend this rare combination with you, Dr. Ali. As senior resident at Sports Injury Center and also for ODS time he represented India at Asian Games. So the symposium will tell you regarding the different scenarios of sports medicine in four different settings. And we will be going through the journey through some images also. There will be questions asked one after one. We want to make it an interactive session. So the questions will be going on. You can raise your hands in between if you find anything or you want to add or you want to ask. Okay, so we think this is that many of the queries are coming every day, sir. We want to take sports medicine, but we have no idea that where is it available, what is to be done, and how is the sports medicine different from a normal guy, a physio guy, or a PMR, or any other branch? And what is the extra advantage that we get from learning sports medicine? Are we learning something different? That's a question that is to be addressed every day. So we will start this symposium in 5 minutes. अरे पेन ड्राइव चाहिए होगी ये लोग पेन मैं एक बार डाल चुका
So since it's taking a little bit of time, are there questions from your end? What is your background like? How many sports physicians are doing PG in sports medicine here? You can also raise that. Residents, residents. Okay. Could you please tell us many physiotherapists? Anybody from sports science background? Okay, till we kickstart this.
Okay, so guys, we are starting the symposium. Okay, so I will be taking questions first to Dr. Mukul in the order of introduction. Okay, so Dr. Mukul, my first question with you. Okay, so Dr. Mukul, as you know that we don't have separate sports medicine departments in corporates, so the idea of opening a sports medicine department came in the picture.
So yes, absolutely correct. I mean, if I talk about Delhi, so I think we have more than 50 multi and super specialty hospitals in Delhi. And every hospital has an orthopedic department, and almost half of them have a arthroscopy and sports medicine department. And probably BNK Max, the place I work is the only place where we have a sports medicine physician also working with them. The thing which was in my favor is my friend and my boss, under whom which I did my master's program. So yeah, this is.
The mic extra over.
So my boss was Dr. Uttar, probably was founding sports medicine center. So they have the vision of always taking these services into a corporate or a private setup where people with similar sports injuries, probably not athletes, but who are working out, young active people, should also get access to all the facilities that an elite sports person gets in terms of probably training or rehab or nutrition and psychology. So I mean, I think we're still very far away from all the hospitals having a sports medicine physician in the sector because of the cost implications. But I think we're slowly getting there.
Okay, so question to Dr. Shah. So man needs no introduction now. So Dr. Shekhar has many experience we go watching sports. But what was your first reaction when you got selected for the female football team nationals? You got selected as a team doctor. What was your reaction?
Obviously, the reaction was happy. I was very happy that after doing my post graduation in sports medicine, I finally got the chance to represent the country, to represent the female senior women football team. But at the same time, I was happy and I was having a lot of responsibility as well because now you're not working in the hospital, you are working for the team, for the entire country, and there are a lot of responsibilities you have to cover. So I believe that yes, the happiness was there, but at the same time, there are a lot of things you have to tackle. You have to maintain that bond, not just with the players, with sports stars, with the physios, with the coaches, so that they can understand that medical importance, how important a doctor, a team doctor is in the sport, how if they are hiring you, they create a difference. Because earlier back then, people doesn't know about sports medicine, they don't know that how much is the importance that you should hire a team doctor. And when you are going there as a team doctor, you should know that you are able to create a difference. Otherwise, no, medical importance in the team is still we have to recognize. So that's what I felt at that time. Thank you.
Okay, thank you, ma'am, for the. Hello, is my voice audible, guys? No. Okay, so you can see this photograph in this Dr. Shekhar is there. Okay, so my next question to Dr. Chetan, consultant at IIS. So Dr. Chetan, what is your experience with the High Performance Center?
Hello, good afternoon, everyone. Yeah, only you inspired us for just sport and you really have great these. In this Olympic, approximately 23 of our athletes went to Paris Olympics 2024. That's a lot of elite athletes. At the same time, we have a lot of elite kids. Starting from age 10. Mainly, we have 5 sports. Five sports: swimming, boxing, judo, wrestling, and athletics, track and field. So what I observed in HPC, how it is different from other aspects is in HPC there is a clarity of growth for everyone, and we have a multi-discipline. Even if I go to speak to a teacher, he knows what is the value he brings into the athlete's time. We might think, okay, what they know, just we want to give order nutrition. No, it's not like that. But they know which oil to use, when to start. And if you speak to them why you're going, they have a reason behind everything. And if you go to SNC guy, go and talk to him, they will tell you why they are doing. When they are, they have a reason for every exercise they're doing. Same as a coach. If they are giving some jumps, they have a reason behind it. Okay, it's not a full group. I don't call it a full group, but yes, everyone has a reason and their roles and responsibility. So when I went there, it was a completely different eye-opening for me. And it was fortunate, like I got a job over there, and we are working with so many different cultures. We have a Georgian, we have a UK based, we have a USA based, we have a Cuban coach, and many of them are Olympian as well. So they know what it takes to go to that level. It's not just a physical, it's not just it's a mental aspect. So if you stay along with them, you also pick up a few things that you also start thinking, okay, it's possible. It's not something different. So when the Olympian coach, he's training his athletes, nothing different than what we are doing, but only the belief. So automatically the athletes start thinking, okay, it's not too far from it, so it's achievable. So that belief itself make a big difference. HPC is not something way beyond. It's the same. What we are doing before I was working in a SIT Sports Injury Center, what we are doing, almost we do the same thing there. But there's a little bit of structure involved, and the clarity is involved, and it's a belief and a faith.
So you can. Hello.
Yeah.
Hello. Hello.
Hello. Hello. Hello.
Okay, so you see in this image that we can see in this image. Can you identify the two athletes in the image? Anybody from the audience? Can you identify the two athletes? With Chetan, who was standing with Chetan, and the other guy who will be in charge with him? Anybody from the audience? Let's make it a little interactive. Anybody from the audience who can identify both these athletes? Okay, I'll give you a hint. Both of them won a medal at Commonwealth Games. One of them was the first non-African to come in a steeplechase in the first top 3 positions after 25 years. Okay. Okay, so the audience is, I think, not interested. Okay. Okay, so my. Okay, yes, one is Parul Chaudhary, yes, good. Okay, yes, and the second one? Yes, very good. Clap for him, please. So it's not only important to know cricketers, just knowing cricket is not sports medicine. You should know about other sports also. You should know how sports can integrate into everything. That is why sports medicine is important. So my next question to Dr. Khyati, a very important question. Ma'am, what are the important colleges and institutes where you can pursue an MD course in sports medicine?
So MBA in sports medicine is through, the admission is through NEET PG, and the colleges that offer MBA in sports medicine is, one is VMMC and Safdarjung Hospital in Delhi, offers 5 seats, now upgraded to 6 seats. We have RIMS Impar having 2 seats. We have PGIMS Rohtak having 2 seats. Then we have PT Diploma in Sports Medicine that happens in Patiala. Going to AFMC, there are again 2 seats of MD Sports Medicine. And then going down south, we have Bangalore Medical College that has now come up with 2 seats. We have Chetnad College, which has 2 seats, Savita Medical College, and SRMC Chennai. So all of these colleges offer MD in sports medicine. Now KGMU Lucknow is coming up with seats, and another few colleges are going to come up with the course now.
So moving on to the next question. So my next question to Dr. Mukul.
Sir, what are your roles and responsibilities as a sports physician in your department?
So our department is department for arthroscopy and sports medicine, wherein I'm running the Center for Sports Rehab. So we do around 1,000 complex knee, shoulder, and ankle surgeries every year. So my primary role is to integrate the rehabilitation into the recovery of those athletes, including the pre-operative planning. I'm part of the surgery team. And post-surgery, I take care of the rehab in terms of planning protocols, nutrition, psychology, and rehab. So this is one primary role that I play at the center. Apart from that, we do have reference from other physicians, including Department of Gynae and Cardiology, where I see patients suffering from problems like hyperlipidemia, diabetes mellitus, or females going through menopause, where I use exercise as a medicine in the treatment of those individuals.
Thank you, Dr. Mukul. So my next question to Dr. Shikha. Ma'am, since a female has to break a lot of stereotypes to play sports around the world. Okay, so since a female has to break stereotypes to play sports, how did you manage breaking stereotypes of female and sports doctor both at the same time?
Well, that's a very tricky question because if I have to start it from the day I joined my residency, my post-graduation, my department was all male dominated. Like, I was the only postgraduate in my department with 25 males from the corner in my team. I used to go to the OT and, you know, I have to say this is a very important thing that gender doesn't define your capability. Okay, yes, there are restrictions, there are times when you feel that you have to share a common room with all the males. But at the same time, if the department and the environment, mutually respectable for you, it is easier for you to just, start doing aware of me. Apart from that, then because my grassroots, level was from the post graduation where I had many males and came to department. So it was not that difficult for me when I went to be it a female dominated, be it a male dominated. And realized that yes, initially there is a hesitation where there are a lot of males because being a female, you always acknowledge that. But they start acknowledging that there is a knowledge. There is something that this doctor or this particular specialist can give you in terms of knowledge, in terms of care, in terms of the treatment. I don't think gender really role to play. There are some males came to me for a long treatment, to choose injuries, that is something, time that we are handling of people, and there is a boundary of restriction. So that's what I think.
Thank you. Oh, thank you, ma'am. So my next question to Dr. Chetan. Sir, what does a high performance center means in terms of athletes and how is it different from any other setups where athletes are trained?
Go back to the question. Slide where we are eutomized testing.
Okay, if I can show you that.
I am just explaining one scenario. Avinash Sabri came to us and he asked like, okay, I want to check my VO2 minute. He only asked, I want to check because I'm going for a training abroad. I want to check what is my VO2 max. And we did the testing, but that time we used a different equipment where you use different in a different place. So it was approximately, I don't want to say the number. There was a difference of 2 ml. And this guy asked us, why it's happening? Well, not. I was trained well before, and compared to the last testing, this time my endurance is good. Why this has come up? So we were given to. So that's how when you come to HPC, when you come to elite athletes, they know what they are doing as. We might be thinking, okay, athletes do not know, but they are very smart. They exactly know what they're doing, how much they're putting load, and when to pick up, because they're not small kids, like they're doing the same work for the last probably, someone has to go to Olympic, probably they've done 10, 12 years of training, 10, 12 years of high quality training. Okay, how many of us have done the same work for the 10, 12 years? No, hardly we have done 4 years that's all. But those guys, they have done 10, 12 years of same training again.
Even 2-3 months. People give up in 2-3 months also.
Yeah. There's so many things. So when it comes to elite athlete, there are different levels. We have to respect their words. If someone is coming and telling me like, okay, I have this problem, I cannot take over, please, you don't want to train. No. They're doing it for the last 10 years, they're saying this, we have to take it. The hospital happens very, someone comes suddenly randomly, they says, I have this back problem, I have this problem, we take it very lightly, but we cannot do that in the high performance center. Because there's a lot of responsibility. And even if they're going for one gym session, they miss one session, people are gonna ask you why he did not turn up. And the coaches are such that if this athlete, if they did not turn up to a mat for one session, or if they turn up only 50%, they'll question me what is happening. If I say, okay, I'll wait for some time, they'll say, okay, why you are waiting? They'll question everything. They'll question everything you say. And if I say, okay, we'll wait for 2 days, we'll see, after that I'll get an MRI. Then he asks me the next question, why you want to wait for 2 days? So you have to have a reason for everything. If you tell them exact reason, they might, because in IIS it's mainly a coach-led program. And coach is responsible for the success. If anything happens, people will go and congratulate him. If anything goes the other way, same people go and ask. So we are working we have to accept what culture we are working in, where we are working, and what's our role and responsibility. When it comes to HPC, it's not just physician, even though there's a physiologist out there. In that case, the physiologist will question like why it doesn't change. So they have to come up with the answer, and we have to plan for the next time to what we can do. That's not a wrong thing. It happens everywhere.
So HPC is actually multidisciplinary, guys. You can't be just like, hey, it satisfies me, not you, doesn't matter. Everybody should be satisfied on every parameter. And you just don't have to make them walk, you have to make them run, you have to make them win. That is where a high performance center is completely different. So it's a very common scenario in India that you don't get much of HPCs here. Right, and Dr. Chetan is working in such a challenging environment, that too at a elite level at IIS. Right?
Go back to one more slide, sir.
Okay, and I can show that.
Yes, sir. Next slide. So I work with it. This is the guy. You can see in the right side. It was not in it's not we went for the environmental assessment. And the physiotherapy before sending, we did our clinical assessment. And we found out, okay, these are the muscles we are to work on, these are the core sheet having. And we went there just for the confirmation. It costs us a lot because he's an elite athlete. He's the world champion in the judo, first world champion from India. And we want to make sure we do not miss anything. And the coach is like, I don't care how much money you are spending, but I want everything that's all. So we went there, and we also found it's good for us also. It's a learning, a lot of learning for us. Every day you learn. Open mind and not say, okay, I know. Even if you're speaking to a masseuse, they know so many things. They can just search and tell, okay, there is this muscle is tight. It takes me like a lot of effort just to see what is the problem. And those guys just touch and say, okay, this is the problem. I make it. It will be fine in 5 minutes. And we see the results. We cannot say, okay, I have a degree. I have to be like, okay, this is my, no. We have to respect everyone's word. Even the intern MPT who comes and they say, sir, I'm not finding something wrong happening. The way you walk, something is wrong. They say, we have to consider those aspects. And again, you cannot consider everything, but you have to be smart enough to what to pick, what not to pick. When it comes to HPC, there are people are there for some reason. If someone is working in HPC for a long time, means he is doing something right. So we have to value everyone's work, and you have to go with the open-minded. And it's a multidisciplinary.
Okay, so my next question to Dr. Kathy, ma'am, how is sports medicine residency different from orthopedics or PMR residency? A very common question by most of the people.
Yeah, this is a common question every year when NEET PG results are going to come out. Everybody is like, okay, what is sports medicine? And how is it different from this? How is it different from that? So the understanding that sports medicine caters a very special group, a population of athletes, of people who are wanting a active lifestyle. That's the core of sports medicine. So when you're treating athletes, when you're treating sports persons, you're diagnosing them. It's not just the musculoskeletal injuries. We are dealing with the medical conditions of the athletes. You'll be very mindful about knowing how particular disease in an athlete may be very different from what you would treat in a general population. And the fact that some of the medications that you give to the athletes, some of them are under doping. So you have to be very mindful about those things. So this is the core of sports medicine. One of the biggest things that you would go to a doctor you would never see an exercise prescription. An exercise prescription is a big part of sports medicine. So these are like the basic differences. When you go to an orthopedician, they deal mainly with the musculoskeletal, the fractures, like all of those things. But in MD sports medicine, you deal with the medical aspects as well. So athletes being the core of it, you also deal with, the lifestyle changes, and you deal with it through exercise. So this is how it is different from the other branches. And when you treat athletes or versus when you treat general population, you want the general population to come back to their normal activities. But when you're treating athletes, you want them to come back to their same level of performance. Plus, you have role and responsibilities in their performance enhancement also. So that's like at the peak. But there is a lot that goes into treating athletes, and that is very different.
So you can see this image of Dr. Kathy doing pole vaulting. How's it that? Well, she is a rare combination of athlete also and a doctor also, right? So she knows much better what athletes do. Right? So it is very important. If you yourself don't have an athleticism in you, you can't make it do others. Right? As simple as that. So my third question to Dr. Mukul. Sir, does your department only cater active sports persons or fitness enthusiasts, or you also provide care to a common layman?
To everyone who comes to us there.
Okay. So sir, what type of care?
If I have to summarize, like 1/3 of my patient population are going to be professional athletes. The other 1/3 are going to be people who are active in their lifestyle and get that injury playing sports, amateur sports, and another 1/3 is probably going to be non-athletes, people who are not active in any kind of sports, but they have problems related to their joints particularly.
Okay. So you see this image that we just don't treat injury, we prevent injury, and also we try to further educate people that how can injuries be prevented. That is where the role of a sports medicine will come.
So this one is secondary intervention. This girl we've done ACL in both her knees 5 years back. She comes back every year just to see how good she's feeling and what's the muscle and all the other jumping parameters. So yeah.
Okay, so my next question will be to Dr. Shah. So Shekhar, ma'am, you have worked with the RCB senior men's team, which is a dream for many. How was your experience when you worked with the senior men's team? Many people want to know this.
It was very good. The experience was incredible, and it was not just because I was doing it, because the team itself is very good, and the kind of support, the kind of mutual understanding. I would first specifically talking about the previous staff. Where a lot of times we had seen that there is the friction that was being in the medical field. People, the soldiers, the teachers, they have to accept the problem, but that was never the case. And I really felt that if you are so honest with your work, if you know that you always are the thing is very much. And I do mention your name and have to right. Then we have the playing and
Good victory on the field also. So sports medicine is not just treating and sending. No, it's about a team approach. You have to play like a team, you have to win like a team, and you have to perform like a team. That's why we need multidisciplinary approach, right? So my next question to Dr. Chetan. So Dr. Chetan, what are the expectations from you as a head of the medical and as a sports physician in IIS? What are the expectations from you? So much is at stake on you now.
More than me, at least an athlete. So there's so much of investment goes on. We are working in we do not know how much they are spending. There's a lot of spending on that. There's a lot of expectation from every medal. We might be saying why they're doing all these things, but that changes. You must have seen one of the Neeraj Chopra got a medal. completely changed. Indian picture in the javelin has completely changed. So that's how one medal can make a difference. Just imagine that one medal is making difference the entire India, how much it make a difference to that person. So same thing, we might be thinking, okay, why the athletes are doing for the national, why they're doing for the district, but that's where it starts. Because even so many times, even I question why they're doing so much. If they go to a job, why it matters so much? Because we are secure people. I'm going after 5 years, if I join an MBBS after 5, 6 years, I will come out some degree. Even if I do it decently enough, I'll come out. If I want to put some effort, anyway, if you go to education, you don't need to compete, even just pass, it's fine. And to get a 50% mark, you don't need to fight with anyone else. You just read something basic, understand, you pass, and you come out. But if you go to sports, where thousands of people are there, you have to be the number one. If you're number one, you're nowhere. Just they will throw you out of that. Because we don't understand, but we always complain why they do doping, why they do all the things, because they're so desperate. So what HPC do is they'll give a clarity. They have a proper guideline like how we work, what we do. As a physician, what I bring into them. As a coach, what they're doing. As a good nutrition, what they will do it. Because if you take me and you tell me, okay, you have to do a nationals and there's so much at stake, I will do anything to get that medal. Because there is no guidance. So when you come to HPC or anyone, sports science or anyone, if you're there, you have to add value to them. And it shouldn't be a tool. If you're saying, okay, you do the exercises, what exercise they're going to do? If you tell them, okay, you do this cycling, they will question you. If there's no guidance, they will do whatever they want and they'll get injured. So whenever you work, like this is just for everyone as sports, not just for the physician, I say, when the physiotherapist, when the massage is there. You should know what you're doing. And you first understand what is the need. We call it an evidence-based medicine. I think most of our doctors know what is evidence-based medicine. It's three components: what the patient requires, what's the clinical expertise you have, and what is the best evidence research as you can call. But when it comes to sport, clinical expertise is very small because we are not exposed to so many cases. And when it comes to evidence, Indian almost, I can say nil. We don't have any normative data. Whatever we compare with the Western. So Indian population is completely different. Because we are talking about supraphysiological values. We're not talking about normal, okay, I did an appendectomy. It's a thing different. But when it comes to performance, it's all supraphysiological. So we don't have any data, we don't have any evidence, so we are almost nil in the two. And the third thing is some patient value, and it's based on combined team discipline. We have to talk to a coach. If someone is coaching for 20 years in a judo, and if dislocation happens, we say, same thing happened to me. There's a Olympic coach is there. One girl in there, she is dislocating her shoulder for at least minimum 50 times. And she is winning a national medalist. She's a national medalist and she is fighting for the job. I went there, see, according to the medical the evidence is less than 20-year-old, one dislocation in the heel, I can go for surgery, don't wait for it. He said, in my entire career, I've not seen anyone after surgery, they are playing at the same level. So then I asked him, like, why? What do you think? What is the problem? He said, like, after the surgery, there's a mental block, like, it will be on a different state. They cannot believe in themselves that they can come back to the same. Because that's like, what do you think from your side? He said, I don't know the reason, but you tell me. Because if, since you come up with that, you tell me what would be the reason. And I was like, probably the rehab. He said, yeah, probably. And I said, okay, probably the type of surgery, because you were comparing to the 20-year back. The things have changed in the last 6 months. So then I was like, okay, these are the things that are there. Then he was like, okay, so what? Then he comes to that, what do you think from your side? Before I said, what do you want? Now he has come to me like, what do you think from this? And I said, okay, because she's already winning at the national level. Only thing is certain confidence. Before there was no confidence in the medical side. We were not sure of what's the going to do.
Dr. Chetan, we are running a little short of time. Maybe you can answer them after suppose it. Though Chetan is giving some great insights, right? This is one of the very common problem with athletes that they say, sir, if I undergo surgery, if I don't play, who will be responsible? Because in an athlete, you have to make him play, you have to make him win. It's not like just like a common man, you just apply a plaster, send him for 6 weeks and make him come back. No. So this is where you have to think differently because everything you are working is a supraphysiological level. That's why athlete is an even bigger challenge. And according to William Osler, he said the most difficult patient to treat in entire medicine is a sports person because you have to take him to the higher level. Right? It's a difficult task.
And one more thing is, these are the high-five things I'm talking about, right? When it comes to ground reality, there are so many days. When yesterday night at 2 o'clock, I got a call saying someone is having a microneedle. So what do we do? at 2 o'clock in the night, and we are away from the hospital facilities, and we have to deal with that. And we call ambulance guy, he's not picking, so we have to make sure that she is safe. That's called responding superior. The most of us know that the master answer. If I have taken the role of head of sports medicine, if anything happens to the health, it's my responsibility. And also, speaking of Mukul sir, I think he was sharing his experience. I think 6 years back, sir went to the Sai camp and something happened at the night, and he was like, I'm just posted here as a postgraduate 6 7 years back. And suddenly the DC, he was talking to district collector and he said, it doesn't matter, it's your responsibility to come and medical officer is your responsibility, ambulance guy. So that's how the question goes. If I send some surgery for the surgery, if there is no monitoring, like we have insurance and everything, no one will like, end of the day, I have to make sure that things done. So administrative job also comes along with that. We cannot expect okay, just opinion or another comment. When you work is a institute and you take in a room, you have to fulfill everything. You have to know where is the oxygen cylinder, where you have kept everything, other than BMW is going well. Even the smallest things, you are responsible for that. Yeah.
So my next question to Dr. Khyati. So Dr. Khyati, what are the common challenges you face as a sports medicine resident in studying the curriculum? Because the curriculum is something which is, we don't have much faculty in India to teach about this curriculum. So how did you cope up with that deficiency and how other residents can cope up with this deficiency?
I think it's a challenge that every new branch faces is that, there is going to be a time where, you don't have faculty. My seniors probably faced more than I did. And at least when I came in, I had somebody to guide me a little bit. But yes, there is dearth of faculty in sports medicine. But it also paves way for you to be a little more independent. You have to be motivated to, make sure that you want to excel in this field. And climb, like the other side, the positive side is you would climb up pretty faster. You would be in a responsible role pretty faster. But things are changing now. We have faculty of sports medicine, and slowly but surely things will change, and there will be more structure. There already is more structure now than it was there ever before. So I think it's just any growing branch, any new branch is going to face this.
Guys, I would like to tell you Khyati's background that she is the international winner of international coaching athletics program in Korea, and also she is a ISSEM diploma holder. So she herself is a great academician, right? She did sports, so she knows most things better than us. So I will be just coming to the last question of this discussion, and you can put your questions and we can answer them one by one. So my last question to Dr. Mukul. So Mukul sir. So sir, it is a very common thing, everything, that how can a sports medicine department help a sedentary person's lifestyle? Because we are seeing a very uptrend surge in lifestyle medicine diseases, including cancer, is getting very common nowadays. And you see the level of pollution which is going out every day in New Delhi, every day the AQI is worsening. Then physical activities itself become a challenge. People themselves are saying that we can't go out. So what is your advice to them and how do you tackle this challenge?
Usually, my patients, I agree them to have a physical health checkup, including their blood work and their labs. Every year, at least once in a year, maybe on their birthday or the chance, they kind of remember that the thing is due. And the second thing is to implement exercise program in their daily lifestyle. So it also depends the circumstances the person, the given person is in. If they have an access to gym, or are they willing to go to the gym? Do they have a pool in their society? Do they have a gym nearby? Then also depending on the accessibility and the openness of the given individual, I would recommend them some exercise program. I try to keep it relatively simple to begin with. I just tell them, for example, let's say 5 sessions of long walks or cycling in a week, couple of sessions of bodyweight exercises. The other recommendation comes in the form of food, just to keep things simple, since they will have a slightly bit more protein because conventionally arranging diet is really short in protein. So I think the key idea is to not complicate things too much for the person who is just coming to you for the first time for this kind of information, and slowly build on the relationship and you see that person every 3 months, every 6 months, probably once in a year, once things are second. And I think the key again is to educate the patient rather than bombarding him with too much information.
Yes, so you have to limit your information, though it's not a convention in India to prescribe physical activity, but how to prescribe physical activity is something that every guy who passes out sports medicine should learn. So the important point he has emphasized, building relationship is first. If you win the patient's confidence, he will even run a marathon someday for you. But building confidence is the first measure that every patient should learn first. So my last question to, and guys, I would like to tell you, this is Dr. Mukul's photo with Dr. Chaudhary, our founder director, and also he's a gold medalist in MD Sports Medicine, first in our department, right? So Dr. Mukul has been a guiding force to me also, right? So my question to Dr. Shikha, last question, ma'am, for you. Ma'am, how do you react to great successes which are up your sleeve, and what is the message to aspiring or currently working sports physician who are looking to you as a role model? You broke stereotypes, you won gold medals in your residency, you work with RCB team, you have a good social media following. How are you holding these challenges up your sleeve and still excelling?
I don't think I've achieved too many things, and you're just being very humble, and I just feel that there is a lot to achieve, and I don't believe in just cracking an achievement and celebrating for the entire next year. I believe in cracking the achievements and aiming for the next one. So I'm very new in the field, if I have to say, just 7, 8 year old, and I am one. And I think there are a lot more things that I can do, but one more thing, that I'm always focused on working in clinical skills, and keep on doing what the best I can do for sports medicine. Rest of the things I fall into place, and the achievements are different. But you should be known as a good clinician. You should be known as a good sports medicine specialist. That's what I believe is the most important thing. Otherwise, the achievements can keep on coming, they keep on going. So it's just a part and parcel. Thank you.
So it is very important that you should all have the hunger to learn more, the hunger to achieve more. That's what makes a sports person completed. So my last question to Dr. Chetan. Okay. So Dr. Chetan, sir, what are the challenges faced throughout your journey till now that inspires you those to us?
As I mentioned earlier, like there's a lot of responsibility comes because currently I'm working in a place where it's completely remote. And everything you have to make sure everything is taken care of. It doesn't matter what time. You don't give a reason, okay, I was not there, I was here, it's light. You have to make sure that things are safe. Because my job is to make sure that they're safe to train. And that RTP also there's, as I said, there's a multidisciplinary team. So we have to sit and talk. There's a communication is a big thing for us. I have to communicate everything what's happening, not just for the one athlete, that to communicate to the other teams as well. As come to challenges, yeah, it's not easy, it's overwhelming at times. And the expectation, as I said, there's a lot of stay at stake. The expectation is too much. So yeah, it's difficult, but going forward, I'm learning a lot. Actually, to be honest, in the last 2 years, big eye opener and learning a lot every day. Even every athlete, I've learned so much, and there's a lot to learn.
Okay, so the last question of the discussion to Dr. Khapi, and we will wrap up our discussion. Ma'am, what are the common types of work and procedures you are involved in your department during postgraduate residency? And are there any different types of setups where different types of postgraduate learning are also available?
So first thing as a postgraduate is to learn how to diagnose. I think you cannot move beyond that. That's the first step. Is to know, is to diagnose the injuries, diagnose any medical condition of the athletes. That is the first step. The other procedures and things that we do is we deal with a lot of conservative management with a lot of PRP injections in your musculoskeletal. We do exercise testing. We do a little bit of we're going to have a biomechanics lab soon, and those assessments will increase. So that will add to performance enhancement. So there are different colleges where different things are there, the strongest points. Like SRMC is big on the biomechanics. So every sports medicine setup in different colleges has their strong points. And I think we can be proud enough to say that our college is going to have everything under one roof. So I think our faculty is also here, and we are very proud that we are able to have everything under one roof, and soon we are going to have the biomechanics lab also.
Okay, so I'm just ending this discussion. So if there are any questions, first I would like to take from the audience. Any questions from the audience? Any questions from the audience? Any queries they want to have answered? Okay, so we will be breaking down for lunch. Thank you so much, guys, that you listened to question. Any question?
I'm Dr. Pradeep from, no, so I'm Dr. Pradeep, working as an assistant professor in the Department of Physiology. We are in Banaras University. So, first of all, it's looking good, like this, sports medicine is coming up as a very good plan and supporting athletes. And then you are also facing challenges to incorporating all these things so that it should be acceptable to the athletes and having faith on the athletes and all. My question is, from my experience, only NIS Patiala started the sports medicine, giving a diploma, postgraduate diploma in sports medicine and all. But for getting that diploma, you should have a MBBS as a prerequisite. So, like as I belongs to physical education center, and we also learned during our curriculum like exercise physiology, sports biomechanics, kinesiology, health education, anatomy and physiology, and all those. So, is there any scope for all those physical educational professionals, those who are interested in sport management to get inside? Because right now there is no option. Because I belongs to medical science, like I also prepared for that. Right now I did my BSc in chemistry, botany, zoology, and all those things. I tried my level best to get some kind of diploma in physiology. I got the admission in Lahore University, London, Newcastle University for the London, but because of the funding, I am not able to get the funding, but unable to do. Calcutta University started those letter diploma, but now suddenly they stopped giving that particular diploma. So, is there any scope because it's an interdisciplinary kind of, or nowadays with ministry and every institution is promoting the interdisciplinary and transdisciplinary kind of learning. So, how to get inside?
We have an answer now. Dr. Sika, can you answer that, please? Anyone wanted to answer, please go ahead.
If I have to go into this, like we have been had a discussion going on for this topic, where a lot of malpractice have been happening in the name of sports medicine. And in the sports medicine specialist by myself, who did her own graduation and the master's, and when you go outside, themselves to the other sports medicine specialist. And we became a national medical professional guideline. The guidelines are very clear. You can have a practitioner, definitely, I didn't know pictures and names and for and I have a sports medicine like people have already books so that they are the way of the next one. Government will ask me to go and picture bank but I'm going to sit there in the line of the money. I've done the thing of the
Yes, I'm not just like a science and all this, but public want to get the knowledge.
Yes.
Once if you are not getting signed up, well, like there are certificate programs, there are
But
diploma.
for knowledge, PhD, for knowledge you can do anything.
For knowledge, you can PhD sports science. PhD sports science.
There are many programs. That's what you
like it's what you want, like biomechanics, like
Yeah.
biomechanics. So there are some kind of certificate program, like nowadays new education policy. They are like we call it a liberal education. So if they want to choose a music student want to learn some kind of musical or something, they have a liberty.
Sir, I wanted to interrupt here. Like we now have to break. Okay, it is rather it is actually we have exceeded the time. Now we will have a quick lunch. Okay, two we will start the next session with Dr. Rina.
Okay.
Now we will have the presentation now.
Okay.
Welcome. Thank you. Please,
My request,
Okay, so we will start the felicitation of all the speakers one by one. First of all, I would like to call Dr. Pindar sir.
come. You have to give the comment front. Yes. Take the picture.
What a moment.
Thank you everyone. We'll have the lunch now.
चेक कर लेते हैं ये किसकी पेन ड्राइव है नाम रुकिए अगले ले ड्राइव से इतनी जल्दी कैसे लंच करके आ जाएंगे डायरेक्ट इसी से चल जाएगा डायरेक्ट शेयर कहाँ परचेज करना करूँ कहाँ शेयर करना ये रुको ये है ना शेयर ये हाँ इसको अच्छा ये गया प्लेटफॉर्म इसको क्लिक करो ऐसे शेयर ठीक है ओके डन